So I'm Flo, this is Laurel.
I'm Laurel.
And there's actually a third name on our opening slide, and that is for Rebecca Hasdell, who was never intended to be here, but Rebecca is actually one of the key people involved in this. She, as part of her PhD work with U of T, did the research. So I did accompany her for a little bit of the in-store assessment, but it was really her that did that quarter and costed in 41 stores as well as looking at availability. So a thank you to Rebecca, who is currently in Halifax at Dalhousie University as a postdoc fellow.
Okay, so we can advance to the next slide. Is it? Okay, so again, as Laurie said, we're both population health dietitians, and I take lead role in food security. So just sort of very broadly, we've touched on what food security means, but it exists when all people at all times have physical and economic access to sufficient, safe, nutritious food to meet dietary needs and food preferences for an active and healthy life. And we can move to the next one. So what does that mean? So within my role with Northern Health, when I sort of speak on food security, I think one of the most important things is it's a deeply, deeply complex issue. It has its roots in a lot of different things. And so we talk about household food insecurity, which is that income piece. So we know that in our communities, lack of adequate income is an issue. And so when people are food insecure, it's when a household food insecure is when a household worries about or lacks income to buy healthy, safe, and personally acceptable food. And community food security is really talking a lot about local food and a lot of food movements that are supported in events such as this. And so it's the ability for all to obtain a safe, personally and acceptable diet through a sustainable food system that maximizes self-reliance and social justice. And then we've also spoken to food sovereignty, and I think it's important really when we understand the nuances of the food system and how deeply colonization has impacted our food systems throughout the North and across our country. So food sovereignty is the right of people to obtain culturally appropriate food and to define their own food system. So we're here to talk about Fresh It. So it's a food, retail, environment shaping health intervention toolkit, and we'll get into sort of the nitty-gritty of what that means. In terms of where that lands with food security and food sovereignty, is it's really looking at encouraging the local food environment and getting a sense of what our local food environment looks like from a retail perspective, and improving agency to local food, and community food security. So how are our local retail food environments impacting food security and food access in our communities?
Next slide. So it's always valuable to start with what is healthy eating, and within Northern Health we do have a position paper on healthy eating that defines what it means for us, because I think depending on who you chat with, it can be very different. So for us, there's a pleasure component, and if you're following with the new Canada Food Guide, you know that they also talk about healthy eating being more than just the food. So it's about getting enough good for you and good tasting food to support you today as well as in the future. So that's looking at that chronic disease prevention piece as well that Sherry spoke about this morning. I draw your attention to the circle or the pie sort of to your right, my left, which looks at the 6 components that we would say in Northern Health are impacting healthy eating. So food, we always say it starts with food, then nutrition, then we're looking at eating competence, which we could chat about that a lot, but we won't, we don't have time today. Culture and tradition, food systems, as well as food security. So it's very complex and layered what healthy eating is. It isn't just knowing the right foods to eat, which is what it sometimes gets boiled down to. And what we recognize is that healthy eating, in order to be achievable by all need to have equitable access to not only individual determinants of healthy eating, but also collective. And part of that collective is looking at the food system and looking at what's available, what's affordable. Next slide. So Why stores? Why were we looking at stores? And that's because we know when you look at the data that 72 cents of every dollar that's spent on food is actually spent in a retail food environment. So we know that it's an environment that has an opportunity to be influenced to support healthy eating choices. What we also know is that when you look across the income spectrum, that people who have less resources in terms of income spend more of their dollars in a retail food environment than they would at a farm gate initiative or at farmers markets. So it's particularly important to see what's happening in those environments and also influence what's happening to support healthier choices being made. And when we talk about stores, whether it's at the national level, whether it's at our local level, that's the whole gamut. So anywhere that you could potentially buy food. So that could be a gas station, or that could be a full-service grocery store, or that could be the drugstore that also sells groceries. So we went into all of those within a particular corridor to look at them. Next slide, Lori. So Laurel's defined what Freshet stands for. This work started in the spring of 2016. We started having conversations, and as the next slide will show you our phases, that was multi-layered in terms of research. So beginning conversations that led to actual research that happened in the fall of 2017. Next slide. Yeah. So you probably can't, yeah, thank you, Lori. So there were 4 steps to this work. Initially, we did pull together stakeholders to get themes that were relevant for us because, well, why was Northern Health chosen? Because there were 3 sites in Canada that were involved in a CIHR grant around Freshet and the toolkit. There was Waterloo in Ontario, there was Halifax in Nova Scotia, and then Northern BC. Part of it was that Rebecca was at UNBC, but as well, we represent something different. When we talk about the North, are we North or is like Whitehorse North? And so we call ourselves the Provincial North, and we are adding something different. We don't have like the Nutrition North program here, but we do have issues with isolation and challenges. I think somebody else talked about the slide and food not being able to get through. So first we did our sort of lay of the land with stakeholders, what are the issues in the North. Then we did GIS mapping of all food opportunities in the entire North. So that's everything from restaurant to vending machine to grocery store to gas station. Then we did an assessment in a section of that, of the North, so from Topley to Terrace, and we went into grocery stores and looked at primarily availability and quality. There are some other costing things that Laurel will chat about, but this is looking at something bigger than just how cheap food is, or not. And then the last piece that we did was a qualitative part to the research, which is where there's qualitative interviews with 7 independent grocers to give a lay of the land in terms of what the realities are here, at least in that corridor. Next slide. So this slide represents the summary from step 1, and these are the themes that came out of those stakeholder engagements. So basically, we're big, with 64% of the landmass of BC. We're big and we're not uniform is the other piece to know, is that we have pockets of communities and we're spread out in different ways. We have a mix of relatively larger urban centers as well as rural and remote communities. And we also know that there's a fair amount of movement if you have the resources to be able to go from community to community. So just because you live in one community doesn't mean that's where you always buy your groceries. And then the third piece is to recognize that we also are home to 35% of Indigenous peoples in BC. We have about 80 Indigenous communities. And so because we went along the highway for the step 3, we didn't actually go into too many Indigenous communities because they're often off the highways, but they were included in our mapping. Next slide. So this reflects step 2, which is the GIS mapping. And basically this ponders for us what is a food store. And that was one of the challenges that we had, is what counts as a grocery store, what doesn't count, what is a convenience store. And we found that it was very, very hard using federal sort of limitations of what to define a store as to do that for us in the North. Because we also recognize that stores sometimes have multiple roles, not only in terms of what they offer community in terms of goods, but as well in terms of what they offer community in terms of services. So because it wasn't really clear on paper, and looking at things like we used actually the environmental health database, public health protection, to do this GIS mapping. So it wasn't clear, so we figured we had to go out and take a look. And this is what we're going to tell you, what we found. So next slide. So I've been sitting in the back, so I bet you can't read this in the back. You don't need to read it. Basically, it's the very last column that you want to look at if you are able to read it. What we found is there were 1,000 in 2017 spring. There were 1,000 food type establishments in the North, so all of the North. And they range from the top 3 speak to food, like grocery store, for example, independent grocery store, discount store, convenience store, and then the bottom are restaurants. Okay, so everything was counted. And what's interesting about this data is that in the North, there are actually more independent stores than there are chain stores. So that's a bit unique, and that likely speaks to the size of our communities and the hubs that we have. Next slide. And again, it's a bit, I think because of the backlight, it's probably hard to see this. This is a heat map, and basically what this is meant to represent is where are those 1,000 stores located. And you'll see, actually I can't even see it very well from here, but this is a program out of Ottawa, so they don't recognize that Haida Gwaii is an island, but that lump to the left is actually Haida Gwaii, so. Unfortunately. But what we see, you'll see the ring that's got like the red and the yellow, that's actually Prince George. So you'll see that there was Fort St. John, northeast area, there was a bit of a pocket of density in terms of opportunities to buy food. There was a pocket in Prince George that was largest, and then along Highway 16, there was a pocket in Smithers, Terrace Kitimat, and Prince Rupert. What you likely can't see because of the projection is that there's lots of little dots in random places in this map for BC. And that just makes sense, right? Where there are fewer people, there are going to be less opportunity and less density. Next slide. And we can probably move on to the next one, Laurie. Okay, so this is the availability piece. And looking at fruits and vegetables, just because of a variety of things, including perishability, including focus, it is one of many litmus tests around healthy eating. And we used a tool, gosh, I'm trying to think of the name of the tool now, but yeah, the NEMS, Nutrition Environments, something study. And I would say there's lots of debate. We probably spent 6 months debating about what tool we were actually use. So it's not perfect, but it did look at that quality piece, and that was one of the pieces that we wanted to look at. Having been in many grocery stores through the North over the last 25 years, it isn't just about whether it's there and how much it costs. It's like, would you eat it, is what we were looking at too. So in terms of produce, there was a standardized list, and so for fresh, what we found is that 94% of supermarkets had fresh. And that doesn't mean that 94% of the supermarkets and 6% didn't have fresh. It means that on the scale of all of these things, 94% of them had some or all of them in the high category. For fresh vegetables, it was slightly lower, so you'll see 99% supermarkets, and then as you go down through the different categories of stores, you're going to see less. So in convenience type stores, there was 0% availability of fresh vegetables. And then the last category was frozen and canned fruits and vegetables, and you'll see that it's relatively high compared to the other in the fresh, which makes sense because there may not even be infrastructure in some of those stores to be able to host fresh vegetables or fruit. So 100% in supermarkets, 75% in grocery stores, 26% in convenience stores, and 44% of other stores. Next slide. Okay, and again, I bet you can't read this at the back of the room. I can barely read it at the front of the room. So really looking at two categories. So across the rows, fresh, frozen, and canned vegetables. And then the second one is fresh, frozen, and canned, fruits and then vegetables. So looking at low and high variety. And then there's the categories of supermarket, grocery store, convenience, and other. And probably no surprise that the larger, more focused on selling food, like the supermarket and the groceries, have more likelihood of high variety, and then convenience stores and other food stores or quasi-food stores have less chance of high variety. But to point out there is in that other category would be things like focus stores. So if you had a meat market, for example, or a bakery, we would have also measured in there, but they wouldn't have high variety because they have a focus on a particular product. So not to think that that other category is all bad. Next slide.
And one additional piece that I wanted to add on to that is we were looking at variety in the stores, and at a provincial level as well, some of the work that we're involved in is the Food Costing in BC report. And the 2017 report just came out this past November, and it basically looks at that affordability piece. So it looks at cost of food as a proportion of income. And we know that the new poverty reduction strategy just came out from the province, and so that's looking at, do households have enough income to be able to participate in our food system? And so I think that's just a really important part to add on to the food retail environment, is we also at the same time need to be looking at whether or not income is sufficient for people to meet basic needs, and we know that food access is a basic need. So the last piece of the puzzle is that Rebecca went through from Top Lead to Terrace, conducting interviews with local retailers who owned these stores. And so there was a few kind of opportunities that she saw based on some of those takeaways from the interviews that we wanted to share with you today. And so one of the big takeaways is that retailers are part of the community and want to provide access to wholesome foods. And so if we can go to the next slide.
Yeah. And so normally I wouldn't read other people's words, but again, because of the size, particularly with some of the longer quotes. And so just one independent grocer talked about, everyone should be able to come into my store and be able to afford to buy a bag of carrots. So just that sense of wanting people to be able to eat fresh vegetables within the limits of what they could do in their store.
Okay, here's one more quote.
And then the second one is our management style with produce is we tell all of our staff, if you wouldn't eat it, don't expect someone else to. If you wouldn't buy it, don't expect someone else to. And care about it, look after it, water it. We have a program, Water the Garden.
Okay, and another take-home is that retailers must balance choice, value, and profitability. And of course, this isn't without its challenges. So the business model of small independent retailers and that competition pressure that they face is an important consideration as well. So next slide.
He says we try to keep our margins low on the produce, so with the intention of having the high turnover, but then if we don't have the turnover, we have the spoilage, which basically obliterates everything as far as the potential for profit. So that just speaks to the pressures in terms of being able to include produce in independent grocery stores.
So customer travel or out shopping is a reality for store owners and impacts their operations. And so we know, of course, in the north that people will travel if they have the resources and the ability. They'll travel long distances, potentially to go to Prince George, to go to Costco. You know, a lot of healthcare exists in other communities and bigger communities as well. So we know that people are going into other communities and will do some of their shopping there, which does impact independent and small operators. So next slide.
It's not just trying to get different things. In this town here, there's not much to do. We don't have much for clothing or groceries. For a lot of people, they want to be able to go into Walmart or Costco or Safeway, go to a restaurant, and then come back to town like they got a lot of money in this town. If you got to do some sort of an x-ray or something, or see a specialist, you got to go to whatever place. From their point of view, if I'm going to see a doctor, I'm going to do my shopping there. Something different, right?
So constant adaptation opens the door to making changes. So the grocery business is constantly changing. And so that means that there is a lot of opportunity to work with small businesses and small retailers. The next slide.
Next slide. Another long quote. It says, when our chain store closed about 1.5 years ago, then I was in here pretty well from opening to closing. Like, it was hectic. We were so busy. But now, since these guys opened up, I'm sort of resting a little bit, trying to figure out where to take the store. It seems like whether it's a new store or new competition or just general changes around the area, you are always doing something or another. Well, if you don't, you probably can't survive. We've done so many changes, you know, just to keep the business going.
Small stores are looking for ways to stand out or differentiate with unique products, but time constraints mean they may need a bridge.
But I do think there's a growing want to, and that's what I'm trying to build here. Oh, let's go to the market because it's cute, and I'm going to see some people I know, and I might have a coffee, you know, and then I'm trying to find those niche products that people want, but I haven't had any time to source out because they are not at the wholesaler, right? So I've been trying to find products that people go, oh, the only place you can get that is in this town.
So what is sort of the main take home from the initial work with Fresh It? It's that smaller retailers are an important part of food accessibility and availability in the provincial north, which is the Northern Health region, and may be a receptive testing ground for new ideas and changes.
And so from Rebecca's perspective with her PhD work, she came to 3 conclusions. One is really working at the store level in terms of promotion and marketing to help customers make choices, to bring a variety of stakeholders to the table to look at locally grown solutions. And I think that includes thinking about particularly the independent stores, being able to work out something with local producers, whether that's local growers or local producers, to have a place, because often the volume is smaller. And then as well, the last bullet is really to create supports for local producers, because it's hard. Next slide. So questions or comments? Go ahead, Lori.
So when I first saw you today, I just want to share with everybody else what I said to you. You know, I often pick up hitchhikers when I'm driving in from New Hazelton to Smithers. And quite often they're women that are going to Smithers to buy groceries for their young children. And, you know, it kind of bothered me. Oh, sorry. It was kind of bothering me that they had to hitchhike into town to buy groceries. I know that there are bus services, and I'm pretty sure that the band even organizes some shopping trips, but I don't know the details on that. But it seemed to me like there's maybe an opportunity there for a grocery store out in Whitsett, and I'm just wondering if that's a conversation that is being had, and does it make sense that Northern Health would enter into a partnership to try and like change that kind of a situation and maybe help get better groceries in a community like that where we know that there's a real problem?
I'll start, and Laurel is the expert in terms of food security in our program. You know, I think any solutions need to be, like from a true community development point of view, need to start at the community level. So I think it's really the community that can support and direct that work. And Northern Health obviously would be a partner. In my time, I definitely have worked with communities that don't have opportunities to be able to buy any food, or perhaps, you know, non-perishable food that you might not see pictured in the food guide, for example, would be what would be available. Or, you know, they can only afford, if they're even able to afford to come out to buy food, it has to be food that lasts for a month or longer. So we certainly have been involved in supporting communities that want to advocate for having local food solutions. I would say that, you know, I know of things like Good Food Boxes. There are people in this room that have been involved in also supporting communities to get food that, you know, perhaps isn't for sale in their community, but is available in their community because of connections with whether it's their band or in some other shape or form.
Yeah, and just to add on to that, one of the, I mean, I wear a few different hats, and one of them is working with local government as well, and thinking about how, you know, creating resources and tools to help local government and local communities support food work. And part of that too is poverty reduction, and that's a piece of that as well, because what we're talking about is lack of resources to be able to travel and move around, which is also an issue. And so some of the work that I do is work with local government in understanding some of the ways that local government can also impact and advocate for poverty reduction in community. And so that's part of the work that the BC Food Costing Report does as well, is it at that provincial level, it adds that bit of advocacy work around the fact that people need to have resources available to be able to move through communities, as well as looking at how are we improving the local food environment. So it's definitely kind of a multifaceted way to impact people's access to food in the North.
Okay, we're going to have to wrap it up so that we can get along with our next presentations, but I wanted to thank you both so much for that presentation.
Thank you.